Good morning everyone, I'm Rosanne Santos, your student nurse from FCAT, and today I'll be performing a return demonstration of immediate newborn care. As you know, providing essential newborn care is vital for minimizing the risk of illness and maximizing each baby's health, growth, and development. So now, I'll put my gloves on. Once I'm done on putting my gloves, I'm now ready to assist to deliver the baby. So, I'll deliver now the baby. So once the baby has been delivered, I'll announce the birth time and the baby's gender. So the baby is born at 11:09 p.m. Congratulations, mommy. It's a baby girl. Next, I'll place the baby on a towel on the top of the mother. Then move the first essential step. Immediate and thorough drying of the newborn for at least 30 seconds. I'll gently dry the baby's face. Then move to the head, trunk, and finally the arms and the legs. This step helps to stimulate breathing. So while doing this, we'll also perform a quick check on the baby's breathing. It's important not to remove the vernix as it provides a protective layer and acts as a natural moisturizer, keeping the baby's skin from drying out. Additionally, we should avoid bathing the baby within the first 6 hours to prevent hypoglycemia and hypothermia and infection. So after drying the baby, we remove the wet cloth to keep the baby warm. Next, we'll place the baby on the mother's chest or abdomen, which we call skin-to-skin contact. Our initial skin-to-skin contact. This step not only helps to warm the baby but also support breastfeeding, strengthens bonding between mother and baby, allows beneficial bacteria to colonize and helps protect against hypoglycemia. To further prevent heart loss, we can now cover the baby with a dry cloth and place a bonnet on their head. Next, we'll move on to cord clamping, but first we'll need to remove our initial set of gloves. Remember, don't clamp or cut the cord immediately. Wait for the cord pulsation to stop. So once the pulsation have ceased, we can proceed with clamping. Place the first clamp 2 cm from the base of the umbilical cord. Then the second clamp 5 cm from the base. After both clamps are secure, we can cut the cord close to the first clamp. Finally, observe for any blood loss as this may indicate potential infection. After this, we can place the baby back on the mother's chest in the prone position. At this point, we'll administer 10 IU of oxytocin intramuscularly to the mother to encourage uterine contractions and help prevent uterine bleeding. Next, we'll prepare the medication in an alcohol-soaked cotton ball. I'll inform the mother saying, "Mommy, I'm just going to clean the injection site and then give the injection." After administering the 10 IU of oxytocin, we'll maintain skin-to-skin contact for at least 90 minutes. Unless there are issues like respiratory distress in the baby or a maternal emergency. During this time, we'll monitor the mother's condition as we move into the third stage of labor, the delivery of the placenta. This typically takes about 5 to 30 minutes and it's crucial because a retained placenta can lead to hemorrhage or infection. In delivering the placenta, we need to be careful or gently guide it out without force. Pulling forcefully could lead to uterine inversion, which is a serious risk for the mother. Once the placenta is delivered, we'll examine the perineal area, lower vagina, and vulva for any lacerations. Finally, we'll clean the mother and make sure she's comfortable. At this point, you can provide a brief health education on the importance of not bathing the baby for at least the first 6 hours after birth. Hello, Mommy. Okay lang po ba kayo? I just wanted to give some advice lang po. Please avoid bathing the baby during the first 6 hours after birth. Bakit po? This helps prevent hypoglycemia. You see, once the baby is born, they are separated from their blood sugar source, which is the placenta, and need time to adjust. So if you have bathed the baby right away, it may cause stress, leading to excessive crying, which can lower their blood sugar. So, it's best not to bath the baby within those first 6 hours. After that, you're welcome to bath them. Also, please keep up skin-to-skin contact. We'll also place an identification band on the baby to prevent any switching. Now, let's take the identification band and put it on the baby's wrist. Mommy, please continue with skin-to-skin contact. Soon, you'll notice the baby starting to open their mouth and move their tongue. This means they're ready to breastfeed. When you see these signs, gently guide them toward your nipple to help with attachment, and the baby can start breastfeeding. Okay, Mommy? So, once the mother is already breastfeeding, we will conduct a healthy chain about newborn care. So, after nyo pong magpa-breastfeed,
Magkakaroon po tayo ng newborn care. Kukunin po muna namin si baby. Una po, lalagyan po natin siya ng ointment sa mata para ma-prevent natin ng infection. Pangalawa po, magsasagawa po tayo ng mga exams. Kukunin po natin ang sukat ng ulo, ng kanyang chest, ng kanyang abdomen, yung length niya at yung bigat po niya. At afterwards po, yung pinakauli, tuturukan natin si baby ng 3 vaccines. So ano-ano po ba ito? Vitamin K, Hepatitis B, BCG vaccine. So bakit po natin tinuturukan si baby? Kasi po paglabas niya po sa inyong mattress, kulang pa po si baby sa mga bitamina. Kailangan po natin ma-prevent ang bleeding at para po ma-prevent ang iba't ibang klase ng sakit. Sorry po mami, marami pong vaccine pero kailangan po iyon ng inyong anak. Ituturok po natin ito sa magkabilang hita po ng inyong anak at sa kanyang braso. After po mag-breastfeed at isasagawa na po natin ng newborn care. So mami, magtapos po muna kayo ng breastfeed. So maya-maya po, kukunin na po namin si baby. So, after breastfeeding is complete, we can proceed with newborn care. First, we remove our gloves. Then gather the covering for the baby before picking her up from her mother. To start the newborn care, we'll weigh the baby. We'll quickly place her on the scale, supporting her head and buttocks during the measurement. Next, we'll perform eye care using erythromycin ointment, applying it to the conjunctiva to prevent gonorrheal infection. Following that, we'll conduct the initial assessment using the APGAR scoring system. Based on my observations, the baby scores 9 out of 10. Her body is pink but her legs appear bluish, which is normal right after delivery. She cries vigorously and her legs are moving and flexible. The pulse rate is good at 120 beats per minute. For the appearance component of the score, we note the bluish extremities, but everything else looks great. Therefore, the overall APGAR score is 9, indicating a very healthy baby. Next, we'll take the anthropometric measurements, starting with the head circumference, followed by the abdominal circumference. After that, we'll measure the baby's length while she is lying on her side. Once we've completed the anthropometric measurements, we can move on the final step, which is administering the vaccines. The first vaccine we will give is vitamin K, which is administered in the leg. The injection helps ensure that the baby's blood can clot properly as they begin to adapt to life outside the womb. Next, we will administer the hepatitis B vaccine in the other leg. This early vaccination is crucial for providing immunity to the baby and reducing the risk of infection. Finally, we will give the BCG vaccine in the arm, which is intended to protect against tuberculosis. After completing the newborn care, we can return the baby to her mother. First, cover the baby before handing her back and encourage the mother to maintain skin-to-skin contact. We should monitor the mother's vital signs and uterine contractions every 15 minutes for the first 1 hour, then every 30 minutes after 4 hours.
Once all records are accurate and complete, we will prepare for the transfer to the postpartum unit. This concludes our return demonstration. Thank you.